Hello, I'm Dr. Azhar Alam, and today let's discuss about a very simple thing, but something which is very common these days, which is how to prevent flu. So, as we know, currently the flu season is going on. People of all age groups, including adults, older people, children, are suffering from flu symptoms like cough, cold, sneezing, fever, body aches, etc., respiratory tract infections. So this is something which is very common these days, and it is practically found in every household. So today I'll suggest some simple measures which we can take at home to prevent and to stay safe from flu. So first and most important is wear a mask. Even though COVID now is on the wane, the number of COVID cases are on the decline, but wearing a mask goes a long way in preventing these diseases, because these diseases are primarily communicable and they spread as droplet infections from one person to another. So if we wear a mask, we are sort of protecting ourselves from this disease. Now at present, this disease is caused by a cocktail of viruses. Unlike COVID, which was caused by a particular strain of virus, currently there are a number of viruses which are causing these symptoms, like adenovirus, parainfluenza virus, metapneumonia viruses. So there is no specific treatment or specific antiviral drug to prevent flu. So what we need is to take preventive measures, so that which will be applicable for all of these viruses in general. So after wearing a mask, the next most important thing is avoiding contact. So if we know that there is someone at home or nearby or at work who is suffering from these symptoms, a very important way in preventing the disease is to avoid direct contact with that person. The other thing also which is important is people who are suffering from this disease should ideally take rest and go into isolation. So if you are having symptoms, it is better that you take leave from work, you stop children from going to school, let them take rest, recover, and then get back to your normal activities. Next is how these infections are spread. These infections are spread when the contaminants or the infectious particles are spread when from the nose, eyes, mouth, etc. So what we need to do is avoid frequently touching our nose, eyes and mouths with our bare hands, because often inadvertently our hands are infected with the virus. So if we keep on touching our nose, eyes and mouths, which are the source of entry for these infections, we can avoid getting infected. The next most important step is hand hygiene. Just like what we used to do in COVID era times, we have to follow good and strict hand hygiene. That is, regularly washing our hands with soap or sanitizer, keeping it clean with sanitizer. That has a very important role in preventing flu. Another important thing is if you have slight symptoms, what you can do is start gargling, because the primary source of these viruses is in the oropharyngeal region. So if we do a simple gargling with something like a betadine mouth gargle, then that can eliminate the virus as well as help us get recovered much sooner. So follow a simple gargling method with a betadine gargle wash. And lastly, nowadays a lot of influenza and flu vaccines are available. It is prescribed currently to get an annual flu vaccination, because that will help you get antibodies. So if you do get infected, your severity of the disease will be much lesser if you are vaccinated. Particular note for school children and children in general. These flu-like symptoms are currently seen very commonly in children, particularly that of the school-going age group. Symptoms could be like running a fever, running nose, sore throat, coughing, body pain. So parents need not get worried, because in most of these situations, these viruses are self-limiting. Clearly, there is no role of antibiotics in general, because currently there are no approved antiviral medications for the same. What you need to do is symptomatic management. That is, if your child has fever, for fever you have to give routine medicines. But the best thing would be that once if your child has symptoms, it would be harmless if you can make the child stay at home for a while till his symptoms are better, because that way you avoid exertion to the child. When the child goes to school or outside, he has chances of picking up more infection and spreading the infection to others. So for children and school children, I would suggest that if your child is suffering from symptoms, you can allow the child to take a few days off and have rest at home. Watch the child closely, observe the child. Hopefully he or she will recover soon. But in case your symptoms seem to get worse, please do consult a doctor at the earliest.